Welcome back, everybody. Bucky, snaggletooth, metal mouth, they're all terms kids have had to deal with when it comes to their teeth. But if your problem is discolored teeth, there are some relatively simple fixes. Coffee, red wine, smoking, all of those things can leave your pearly whites looking not so pearly. But today, there are more options to get them bright and white again. Please welcome neuromuscular cosmetic dentist, Dr. Karan Wade, to tell us about a few options along with her patient, Carmen Dent. Hi. Okay. Neuromuscular cosmetic dentist. I've never heard of that particular.
Well, what neuromuscular dentistry is, it's a dentistry that actually studies actually how your muscles move your jaw,
wow,
how your teeth are in relationship to your jaws. Actually, there's your relationship of your teeth to your neck. People suffer with neck pain, back pain, and they think it's other things, but actually they have an imbalance in their teeth.
Okay, very interesting. All right, so when it comes to teeth whitening, it's like the biggest thing today because there are some options available. I want to start with the really simple things that we see all the time, and I want to know what their effectiveness is.
Okay.
Like, there's 5,000 toothpaste on the aisle that say brighten, whiten. How effective are those really?
Okay, so the toothpaste actually do work, but actually what's in the toothpaste, they have abrasives in it. And they actually just kind of scrape the surface of the teeth and remove the stains. They don't actually penetrate into the enamel and remove any of the stain. They just scrape the surface of it.
Yeah.
So they work, but over a long period of time, you don't want to use them because they will start to deteriorate the enamel, cause it to erode away.
So I guess the grandmama thing of baking soda is not not a good idea.
Not over a long period of time. No, not at all.
What was happening with your teeth that was just really bugging you?
Well, I'm a coffee drinker in the morning, and I drink wine at night, and I wanted a fix, a quick fix.
Yeah.
And I was using the at-home care, and I decided, what can I do to get the stains off my teeth?
Yeah, she mentioned home care. How effective are those kind of take-home trays?
The take-home trays, they actually work pretty well because actually, especially if you get them at the dental office, the concentration of the bleaching gel is a little bit more stronger than you would get over the counter. So what happens in the dental office, we actually take the impressions of your teeth or a mold of your teeth, give you the bleaching gel, you take it home, you put it in your trays, and they actually will bleach your teeth. Yeah.
That's a big difference. Now, had your teeth been white originally? And then what happened was just over, you mentioned the smoking and things. There are several things that can impact the color of our teeth.
Oh, absolutely. Tea, coffee, red wine, the sauce that you put on pasta, that will actually stain your teeth. There are a lot of things that will stain, cigarette smoking, cigars, things like that. All that will stain your teeth.
Yeah.
Actually, yeah.
Okay, so there's a different method. So the one that you used on her.
The one I use on Carmen, I use the Zoom whitening. That's one all movie stars use, right?
Yeah.
She wanted a movie star smile, so she came into the office and she had the Zoom whitening done. And what we actually did with Carmen was we actually painted the gel on her teeth, and you said then there's a light that activates the gel, and it takes 45 minutes to an hour. Carmen, actually, we reached the color that she was happy with in 45 minutes. She didn't even go the whole session.
Wow.
So she was really very happy.
And that's something that's important too. When you go to someone like you, cosmetic dentistry, that you really look at. You don't have to have the whitest, brightest teeth.
Sometimes it looks like chalk if you go too white.
Yeah. You want to go a color that looks good with someone's skin.
Exactly.
Okay. So there's a take-home versus the in-office procedure, and you talked about how some of them can be effective, but is this one going to be a much more effective one?
Well, actually, the Zoom whitening, a lot of patients like it because you get that instant gratification. You don't have to wait. A lot of patients don't want to wait the week that they have to use the take-home trays, and you put the gel in. They don't want to go through that whole ordeal. They want instant gratification. So the Zoom whitening is perfect for them.
What I love is that it took years for your teeth to get discolored and 45 minutes for you to light it off. Okay, now that she's done this, does she need to stop with the smoking and the drinking and all that type of stuff?
She needs to stop drinking the red wine and the coffee.
Or do it with a straw?
Oh, do it with the straw, absolutely. She can do it with the straw.
Okay, are you using a straw now?
I will.
Yeah. Or I'll just go back and get zoomed again, right? Zoom. All right. Dr. Wade has 3 certificates for a take-home bleaching, and we'll give those, pull those names during the commercial break. Thank you very much. And for more on Dr. Karan Wade's services, give her a call at 713-654-7756, 713-654-7756, or log on to cosmeticdentaltexas.com. They can come up with deal with any issues that you're having with your teeth.